not following the prevention methods, the infection prevention and control measures, then that is when you will have outbreaks. So the government has decided that we will increase the curfew hours. Presently, the curfew for the island is from 5 a.m. to 11 p.m., which we usually say the other way around. So the curfew would start at 11 p.m. and end at 5 a.m. the following day. What we are going to do for the parish of St. Thomas is that we will increase the curfew hours. The curfew hours, therefore, for the parish of St. Thomas will be from 7 p.m. to 5 a.m. the following morning. We will have this new curfew instituted to restrict movement as of tomorrow. So as of August the 18th, the curfew for St. Thomas will be 7 p.m. to 5 a.m. the next morning for every morning and every evening for the next 2 weeks. We're also taking measures to restrict activities within the parish of St. Thomas. So we're saying now, which will be in the new order, there will be no funeral services at churches. Unfortunately, wedding ceremonies would be affected as well. Entertainment would be affected as well, and civic services would be affected. And this is for the next 2 weeks, starting tomorrow. Please note as well that we are monitoring communities, not just in Clarendon and in St. Thomas. We're also monitoring communities in Kingston and St. Andrew, where we are seeing a number of active cases emerging, and we considered carefully because we know the stigma that can be placed on communities when they are named. But we have to weigh that with ensuring that the residents in these communities understand the threat and take the necessary precautions. We cannot always return to lockdowns. We cannot always return to shutting down the country. We have to learn to live with COVID. And the way to live with COVID is for every single Jamaican to responsibly, faithfully, and consistently follow the infection prevention and control measures. And we know what these are. If you're going out in public, wear your mask. If you have to take public transportation, wear your mask. If you are ill with flu-like symptoms, respiratory challenges, if you're coughing, sneezing, stay at home. Reach out to the health services. If you are in a gathering of no more than 20, that should be, then ensure that you maintain social distance. If you're attending an event, the organizers of the event, they have a duty to ensure that chairs and tables are physically distant to ensure that people are not in close quarters. If you touch unknown surfaces, but even if you don't, wash your hands regularly, sanitize your hands if you can't wash them immediately. These measures work, and I can only encourage our Jamaican citizens to follow them faithfully and consistently. So the Ministry of Health has advised the Cabinet of concerns in the following communities: Duhaney Park, Patrick City, or rather Patrick Gardens, Pembroke Hall, Corryville, New Haven, the Halfway Tree area, Hughenden, Arlene Gardens, Malines Gardens, State Gardens, Zadie Gardens, Constant Spring, Barbican, Meadowbrook, Havendale, Delacree Park, Olympic Gardens, and Waltham Gardens. We're asking residents in these communities to exercise even greater care. Wear your masks, social distance, wash your hands or sanitize regularly. If you're ill, stay home. Make contact with your health service providers. We will be monitoring these communities very closely. And the reason for this, obviously, is that cases have popped up which have not been epidemiologically linked, meaning that they can't trace the source. Not that there are many cases, but the fact that you have seen a case where you can't trace the source could suggest that there is a general spread and you want to be sure. So we are being very cautious. We're being very upfront with the public to tell you what the threat is so you can act responsibly. I'll close my presentation just quickly to say that tomorrow is nomination day. I have today spoken with the leader of the opposition and I have informed the members of parliament for the areas in St. Thomas and Clarendon that are affected. We have agreed that as leaders of the country, we will be scrupulous in following the rules, that we will be consistent and firm in ensuring that our supporters follow the rules, that how we organize the activities for the day are consistent with the agreement and measures recommended by the Ministry of Health, and which both parties would have agreed to, and was published by the political ombudsman. This is against the backdrop of what is happening in St. Thomas. It means that the political parties must exercise great care and caution, that our supporters must understand that we cannot conduct a campaign in the routine, normal way, that this campaign is a COVID-19 campaign, that the protocols must and will be strictly observed. I'll invite the Minister of Health to give further details.
Thank you, Prime Minister. So I'm going to just read from a statement. The country, of course, is aware, as said by the Prime Minister, that through the Ministry of Health's ongoing monitoring and surveillance for COVID-19, that we have these quarantine communities which are going to be extended for an additional 2 weeks. St. Thomas communities, Bamboo River, Church Corner, and Lower Summit. To date, the Ministry of Health and Wellness has conducted more than 300 home visits and collected in these communities some 700 samples. Based on test results received, we can now report that approximately 89 persons have been identified as being positive for COVID-19. 45 of that number are within the quarantine area. The surveillance activities has also identified more symptomatic persons who have been tested and are awaiting results. So the combination of the positive cases within the quarantine zone and positive cases outside of the quarantine zone, plus additional tests that are being done from persons who are symptomatic, has caused us to be more concerned about that parish, hence the measures that the Honourable Prime Minister has announced. So the evidence points to continued transmission. That's the general conclusion of the health team of the disease within these communities, and therefore, in order to manage the risk associated with the spread or potential spread, we've agreed for the extension for an additional 14 days from the 20th of August to the 2nd of September. Additionally, approximately 20 communities within the parish of St. Thomas have been impacted with new COVID-19 cases. These communities span the entire length of the parish and therefore indicates a sort of community transmission, if you will, that are some epidemiologically linked, others not, and hence the need for a greater level of alertness and concern and the measures that have been announced. In order to, well, the Prime Minister has announced the new curfew hours. That's 11 p.m. to 5 a.m. From 11 p.m. to 5 a.m. to 7 p.m. to 5 a.m. for the next 14 days. And of course, spoken to gatherings such as funeral services and so on not being allowed beyond 15 persons. The Ministry of Health and Wellness has also advised that there are additional communities of concern within the parish and that measures will be recommended to manage the spread in these areas. And as was said by the Prime Minister, in the next few days, with better particulars on these communities being made available, it's an ongoing effort, then the Cabinet will consider and take the appropriate decisions which will be announced in the form of an order. For Clarendon, the quarantine area in Clarendon, Sandy Bay and adjoining communities also seeing new cases of persons with symptoms. To date, the ministry has advised that their surveillance has covered more than 900 householders with more than 2,000 individuals interviewed. And based on the testing that has been done, some 22 persons have been identified as COVID positive. And of course, this scenario, based on the risk assessment, indicates and has caused us to conclude, the health team that is, that a recommendation be given for an extension of the quarantine area. So again, concerns there, and we're continuing to monitor and to collect information, and will advise in more details as to the specific communities, if additional communities are to be added. The Prime Minister has outlined the communities in Kingston and St. Andrew. This is concerning to us, and let me just emphasize again, as said by the Honourable Prime Minister, that the challenge we have with the cases that are popping up in some of these communities is that these are persons who present to their health centers and hospitals with symptoms. So it's not that they were in quarantine in most cases and then they have symptoms. They present because they are ill, and out of the testing, they are diagnosed, of course, as being positive. The challenge with that, of course, is that it now requires contact tracing, because in the immediate course of the positive diagnosis, there is no link to a positive case. It's a significant amount of work that has to be done, but the challenge, of course, is that they could have been in touch and contacting many other persons, their friends, families, communities, and by extension, therefore, the possibility of spread could be a very real one. So I'll just, for emphasis, mention the communities again. So it's Duhaney Park, Patrick Gardens, Pembroke Hall, Corville, New Haven, Halfway Tree area, Hewenden, Arlene Gardens, Malines Gardens, State Gardens, Zadie Gardens, Constant Spring, Barbican, Meadowbrook, Havendale, Delacree Park, Olympic Gardens, and Waltham Gardens. And again, it's not an issue of large numbers, right? So I don't want the public to interpret this as having multiple cases. It really is an issue of cases that are presenting, which now requires contact tracing, and the possibility, the chances of other persons being contaminated based on the movement of these individuals in these communities is a very real one. And the history of the virus suggests that that is the case. In the case of St. Thomas, it was a person in St. Catherine who visited friends and family in St. Thomas that created the spiral that led to the quarantining of these communities, and now we see significant others taking place. So it only takes one person, and that information is to be had on these individuals over time. But what we say to these communities, members in these communities, please take the necessary precaution. As the Prime Minister said, wear your mask, hand sanitize, maintain the physical distancing, standard procedures. It should become now the new norm. And it's important to be transparent about this so we are aware and that we take the necessary precaution. Again, over the next few days, maybe a week or so, we will provide as much information as we have on these communities or on individuals, just to keep the public informed. And I just want to emphasize from a public health perspective, in light of any activity that you partake in, of course, the extraordinary activity being our elections, that we take all the necessary precautions so that we protect ourselves and protect others. Thank you, Prime Minister.
Thank you, Minister Tufton. Just for clarity, as it relates to civic gatherings and social gatherings in St. Thomas, we're saying no funeral services. Burials may take place, but the restriction of 15 persons, inclusive of the burial attendants and the pastoral delegation. That is the limit. There will be, in effect tomorrow, a curfew starting at 7 p.m. So nomination day activities, which don't normally go up to that time, should be finished with enough time for persons to return home. This is the way in which we will have to live. It is not the most convenient way. It is very disruptive. But we find that it still allows life to continue, the economy to continue to grow, to recover, whilst we as a people internalize and start to model the behavior that will allow us to live with this virus. We would be available for a few questions. I personally can't stay for more than 2 questions because I have another engagement. This was an impromptu press conference, as you can imagine.
All right, thank you, Prime Minister, for those comments and certainly the information that has been presented. As was organized with members of the media, we'll take questions concerning COVID-19 first. If there are others, then we'll try to accommodate after we have completed the COVID-19 questioning. Let's start off then with Mrs. Dion Jackson-Miller from Radio Jamaica. Dion? Let's try again. So there's no picture or camera on. We just want to make sure that everyone, once I call you, you then unmute to ensure that we can hear you very well. Dion, are you hearing us?
Thank you so much.
Okay.
Thank you so much, Naomi.
Wonderful.
For the record, it's you guys who had muted me. I couldn't unmute. 2 questions. We continue to get complaints, contrary to what we're hearing from the Ministry of Health, that there's a lack of PPE for health workers, and in particular N95 masks. Getting that from multiple sources within the public health sector. Could we get a response to that? And second, I have just received information or a complaint that UA Hospital is refusing to take newborn babies in need of specialist care without a COVID negative certificate, which I'm told is extremely difficult to get. That as a result, Bustamante is being stretched, and this could turn into a serious situation. I understand UA isn't in the same category as the other hospitals, but obviously such a decision like this will impact everybody else as well as care to the public. Can I get some comments on that?
Dion, thanks for those questions. I certainly was not aware of what you have raised. The Minister of Health will come and address what you have said.
Thank you, Prime Minister. The PPEs and this sourcing of PPEs is an ongoing exercise. As far as I am aware, and I checked up to a few days ago, there were stocks of PPEs. First of all, let me just say that the National Health Fund has been charged with sourcing in keeping with the experience that they have, the PPEs that the public health system requires. And they coordinate with the regional health authorities and through the regional health authorities with particular institutions, the hospitals and health centers, to ensure that the supplies are adequately stocked. As far as I am aware, based on a list that I saw, for the most part, we have adequate supplies, and they receive supplies almost weekly. As it relates to N95 masks, the supplies are normally low, and partly because the N95 mask that is made by a particular manufacturer, I think it's 3M, is in short supply globally, and what the NHF has had to do is to try to source through different means, and when they do they get limited quantities. Up to this morning, I spoke to Everton Anderson, who is the CEO of the NHF, who told me that he was getting in 10,000 in a few days. I think he got some last week. He was getting an additional 10,000 via Germany and London that is coming in on a British Airways flight, or I'm trying to be as specific as possible. But that's the kind of quantities that we get. So I would not discount the possibility of having periodic shortages, or at best very low stock, in particular of the N95 masks. For the other items, my understanding is that they are more readily available. But the particular N95 mask that the doctors fit and require has a global shortage issue, and it contributes to the low stocks from time to time. But I will do some follow-up to see how bad that is, and if in fact hospitals are out of stock. And we will determine how we go about dealing with that. As it relates to the second question, which is the question related to UWI and the admission of a newborn, there is a general rule across the public health system, as I understand it, where depending on the procedure to be administered on the patient, surgeries, there is a COVID test that is required as a standard rule, as I understand it. I don't know about not admitting a newborn because without getting a COVID certificate. I would have to check on that to see exactly what that is about. I've never heard of that, but I'll certainly follow up with the university management to find out, because the university does administer COVID tests. They are one of 2 centers that do testing, so requiring a COVID certificate would mean an obligation on their part to conduct that test. So it would be surprising for me, to me, if they were requiring a COVID certificate when they are the actual ones who collect the samples and do the tests themselves and the National Public Health Lab. So I'm not sure about that, but I'll follow up.
Thank you, Minister. Just as a matter of note, the Prime Minister did mention that he really had to proceed to another engagement. Of course, this is an emergency briefing called following the information contained at Cabinet. So, again, we apologize for his being able to go.
I was being just given a little signal here. If the test is required of a patient that's coming into the country, and the UWI does provide medical services to the small islands in particular that may not have this specialty, normally they would require COVID tests for patients coming in. So I don't know if that's the clarification that is required, but it would be unusual for them to require a COVID test for patients who are in country when they are the ones who actually administer the test. Thanks.
Thank you, Minister. And so we gather that you're the only one, well, of course, with your team and, of course, P.S. Sewell. So, ladies and gentlemen of the media, we do have P.S. Dunstan-Bryan from the Ministry of Health and the CMO, Dr. Jacqueline Bisesa-McKenzie, staying with us, along with our own permanent secretary here at the Office of the Prime Minister, Mrs. Audrey Sewell. Let's then go to Mr. Edmund Campbell from the Gleaner. Edmund. All right, let's take Damien Mitchell first. Damien, go ahead, please. Damien? Yes, you can speak again, Damien.
Thank you. I was trying to unmute myself. I was muted by you. So, Minister, could you take this question then? The government has indicated that the days of moral suasion are over. So does the Ministry of Health or the government intend to report to the police for possible prosecution the JLP's Dr. Ryan Simpson for alleged breaches of the Disaster Risk Management Act? That's question one. I'd appreciate if you can answer. I have a second question.
Well, look at it this way. We are committed to pursuing anyone, any individual who breaches the orders that are out there. The police has, in fact, done multiple investigations, have apprehended a number of persons, and as far as I'm aware, there are no exceptions. I can't give you the specifics of that case because I'm not aware of it, but as far as I'm concerned, the government is very clear. The Prime Minister has given a clear mandate that those who are in breach should be dealt with according to law.
Just over a month ago, the Prime Minister had indicated that an election is due in 2021 and it was not on his mind. As a member of the cabinet. Are you hearing me now?
Yes, I'm hearing you now.
Yes, I'm saying just over a month ago, your Prime Minister had indicated that an election is due in 2021 and was not on his mind. As a member of the cabinet, he had also indicated that the Jamaica's economic recovery was on his mind. Can you indicate whether you are satisfied that there has been any significant change between then and now in respect of economic recovery, allowing for the calling of an election?
Okay, well, I'm not going to attempt to read the Prime Minister's mind. What I will say, though, is that the Constitution of the country does allow an election to be called within a particular period. Of course, we know when it's constitutionally due, 5 years after the previous elections. And I think the Prime Minister is well within his right to exercise his mandate or his authority to call at any point. So, I would leave it at that. He has done so, and he has done so within the laws of the country.
I'm asking, though, Mr. Tufton, whether you are satisfied as a member of the cabinet with what has been done between then and now in fulfillment of what the Prime Minister had said.
Well, you're referring to a discussion that I'm not aware of, but what I will say that as a cabinet and as a government, we have been absolutely responsible in terms of the management of the economy, in terms of the management of the COVID risks. We have had to make some tough decisions based on the risk assessment at any particular point in time, as we have had to do as it relates to the economic management. And so if you're asking me if we have acted responsibly as a government, I will give you I would say a resounding yes. And the calling of elections, again, I repeat, it's the Prime Minister's call, and he's allowed so to do. And he has done so, and we should allow the democratic principles of our Constitution to take its place within a responsible way, of course, because of the COVID challenges that we have now.
Thank you, Minister. Let's go over to Edmund Campbell. Edmund?
Yes, I was muted while I was trying to get in. All right, 2 questions for you, Minister Tufton. As the Minister of Health, as you know, you just spoke about tough decisions being taken by the ministry. Is it settled legal opinion that quarantine or COVID positive electors will be allowed to vote on election day? And how will that be accommodated by the respective parties as well as the EOJ? And secondly, in light of the risks posed by, of course, COVID-19 to the elderly and especially, well, those with underlying conditions, what measures have been put in place to provide greater and easier access for these persons on September 3, who obviously would want to express themselves at the polling station?
Okay, so I think the public needs to appreciate the difference between quarantine and isolation. Isolation deals with patients who are positive, confirmed positive for COVID, and they are normally kept in a health institution, either a hospital or in a facility that the government, through the Ministry of Health, would have put together or assume control over to house these persons under special arrangements. Otherwise, there are cases where persons stay at home, but those cases we assess and determine that they are fit and proper for someone with a highly contagious virus to be housed without representing a risk to others. The global position on highly contagious diseases is that those persons would represent a significant risk to others if they were to abandon the protocols around which persons with highly contagious diseases are housed. Clearly, in cases where they are very ill, it would be a risk to them. In cases where they are asymptomatic, it would be a greater risk to others. And so the public health position is very clear that persons who are positive, and we have 200 plus such cases currently, they should not be allowed to represent or to pose a risk to others on election day or any other time. They should remain in isolation until they are deemed fit or cured and therefore can go about their normal life. For persons in isolation, in quarantine, these are persons who are under observation and therefore are not confirmed positive cases. They're serving a time to determine if the virus is present in them, but the assumption has to be made that they should be allowed, under certain circumstances, the right to exercise their franchise to vote, given that they are not a confirmed positive case. The issue has come up a number of occasions over the last couple of days, and I think the public health team will be having further discussions with the Electoral Commission where both political parties are represented, to just clarify the issues around quarantining and what the special circumstances would mean for those persons to be allowed to vote. But as of now, the position is that those persons should be allowed to vote, and there are about 28,000 or so currently Jamaicans who are in home quarantine, and that's a fairly significant number.
Thank you, Minister. Let's go to Brittany Clark from Nationwide Radio. Brittany.
Good afternoon. This is Nika Lewis sitting in for Brittany.
Thank you, Nika. Go ahead, please.
Yes. So my first question is as it pertains to Edmund's question regarding the decision from Cabinet re COVID positive patients on election day having a right to vote. I do understand that the last interaction we've had, certainly at Nationwide News, with Glassgold Brown, Director of Elections, he mentioned that there was nothing in law preventing an individual, even with the coronavirus, from exercising their franchise. And so is the government willing to accept legal ramifications of not, allowing an individual who may even be displaying symptoms to go to the polls?
Right. So I've just offered the public health strong advice and recommendation. I've also said that there will need to be a conversation which should be had very shortly with the Electoral Commission as it relates to that position, because from a public health perspective, there is undoubtedly a significant risk to others if a positive case were to be allowed to congregate or to participate in any process that would lead to potential exposure of others. So we will have to reconcile those views, but I'm being very transparent and open as it relates to public health stance on the issue.
Thank you, Minister. Let's go to Kirk Wright of TVJ. Kirk, good afternoon.
Are you hearing me?
Yes, we're hearing you. Go ahead, please.
Good. My question is, based on the emerging concerns now with the COVID-19 cases, are we still on track to open school September 7th?
The COVID response, or should I say the COVID monitoring and surveillance, is literally a day-to-day activity, ultimately leading to an observation of trends and an assessment of risks. As of now, there are concerns. I will put it no stronger than that, because I will rely on the public health team who are actually doing the actual monitoring, and they would of course recommend to the Cabinet what their perspective would be as it relates to school reopening. We still have a little time, but it is worrying that we have seen these cases popping up in St. Thomas, but also in other parts of the country. And we need to respond in a way to get a handle on this And if not, it could have implications, but I'm not prepared to say definitively, because ultimately it's going to be a cabinet decision that will be influenced by the public health advice.
Thank you, Minister. I am understanding that we have one follow-up, and so after this question, we'll certainly wrap up. Mrs. Jackson-Miller says she has a follow-up question.
Thank you so much, Naomi. Dr. Tufton, we've seen, following up on Kirk's question, we've seen Trinidad, Ghana says they're not opening September 7th. We've seen Trinidad saying school is unlikely for the rest of the year. As you continue to monitor, as you said, is that something that is being actively considered? And two, in terms of all the information you've given, is that an indication that calling an election at this time, in fact, was the wrong decision?
Okay, so let me take the first question. As I've said, the likelihood of a postponement or delay are real, and I don't think anyone would disagree with that as a possibility, because ultimately the health and wellness and the health and safety of our children and indeed our population would be paramount. But it has to be dependent on the public health assessment of the risks and a recommendation that would advise accordingly. And that is an ongoing, almost daily activity. We assess and we discuss every single day, multiple times of the day. And if we have to advise the cabinet, either under extraordinary circumstances or otherwise, we do so. So as of now, I'm sorry I'm being vague. I can say that there are concerns as it relates to the cases that we have seen, which is why we're here and announcing communities and quarantining communities. If the trend continues, it could be a challenge, but I will await some more time and assessment, and then the cabinet, of course, will make the decision, and I'm sure the Minister of Education will speak accordingly. As it relates to the timing of the elections, the question is there ever a wrong time? I mean, the Constitution allows it. The truth is, when the elections were announced, the issues around COVID would have been part of any consideration, just as it would be of any other decision that would be taken as it relates to running the government, because of the ongoing advice that we get. So I am sure the Prime Minister would have weighed all the issues, including the COVID response, in taking this decision. And he would have acted as he normally does, in the best interest of the country, and the decisions would flow from that. It is very dynamic, however, and the country needs to appreciate, and we've always said, that once we lift restrictions or ease restrictions, the risk around COVID would be adjusted. And a lot would depend on not just the response from the public health team and other agencies, but also from compliance and self-regulation by Jamaicans, by others who come in. And what we have seen is in too many cases is that many of us are not observing the protocols. We have over 28,000 Jamaicans who are now in home quarantine. We see almost 2,500 persons coming in on a daily basis for business, for tourism, and our locals. And the success that we have is going to be a function of not just the decisions that we take in government, but also compliance on the part of others. Finally, the Prime Minister has made it clear that in the interest of Jamaica and Jamaicans, if there is a need to pull back, we will do so, ultimately guided by what is in the best interest of the people of Jamaica.
Thank you so much, Minister. We'd like to thank as well the Prime Minister, the Most Honourable Andrew Holness, who was here with us earlier. Of course, Minister Tufton, the Minister of Health and Wellness, the Permanent Secretary at the Ministry in the Ministry of Economic Growth and Job Creation, of course, the Office of the Prime Minister, Mrs. Audrey Sewell, Permanent Secretary at the Ministry of Health and Wellness, Mr. Dunstan Bryan, and of course, the Chief Medical Officer of Jamaica, Dr. Jacqueline Bisesa Mackenzie. Thank you too to members of the media and members of the public for tuning in. We do wish you a safe and enjoyable rest of the Monday. Good day.
Thank you.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.